Trust
So
is
while we were waiting for you, we
yeah,
were talking about this, and from a pharmacist point of view, um, I just feel very strongly that it's super important for whoever is providing medical care to have all the answers they can have. Because if, for say, you are treating a female, and I'm sure this happens, a young girl, a teenage girl, and she's pregnant and she identifies as a boy. What could happen to this individual without all the knowledge could be very frightening, in my opinion. So, how you treat someone, isn't it in your mind as a physician or as a pediatrician to know everything you can about that patient?
yeah, of course we want to know that. And, we want to be as kind as we can to
Sure.
patients and understand, of course, all those things are true. We need to know what anatomic body parts they have, whether they identify as male or female, we need to know what organs they have inside of them, right? To understand, I'm not going to diagnose testicular torsion on a female patient
Right.
unless
Right.
unless this is someone who is a transgender female who is biologically male, right? So we have to know this information. But the questioning has become, it's just gone too far. As we try to incorporate the very few people that were actually transgender in our society, as we try to incorporate them into our regular world and be kind to them and do all the things that we want to see happen in a kind and loving society, we've gone too far. We are teaching children as young as 4 and 5 years of age that they have a choice in their gender, and they really in fact don't. The mental health consequences of going down the transgender pathway are huge. And we're instilling in them a lot of problems if we tell them things that they're not. We should be building them up. You're a lovely, beautiful girl. Look how gorgeous you are. You are so smart. You're amazing. Let's help you become the best person you can be. Or the same thing for the boys. Why we need to focus on the healthy children and not inject our nation's children with chemicals and do
Right.
surgeries on them that are harmful to them in the long run, especially when they're pediatric patients and they really can't make their own medical decisions for themselves. And now, with increasing legislation, we're taking that ability away from parents as well. So this is getting to be very terrifying. And I think back to your original question, I'm not sure if you had a question or more of a statement, but yes, we need to know what anatomic body parts someone has as we're making diagnoses, right?
Right.
Yeah, but there was a recent situation that came up in North Idaho, I believe, but it was a family that went in for their child's kindergarten meet and greet the teacher, and they were asked to list their child's pronouns on the kindergarten intake form. And this was in Idaho. Why would we do that? Again, these are extraordinarily rare to have a child identify as transgender on their own volition. I would say it's
Right.
impossible at the age of 5. It's just not possible. They barely know that they're a boy versus a girl at that age. So
Or do they care at that point?
exactly,
Right. They don't care.
yeah,